As expected, now that the borders are open, we are seeing increasing numbers of cases, people coming across the border, and we are seeing cases of COVID-19 across the state. This is exactly what we expected, this is what we've planned for, and that's why we are now allowing this to happen now that we have very widespread vaccination in the community. So just to reaffirm what we've just heard, we've had 6 confirmed cases, all from overseas sources, New South Wales and Victoria, and 5 of those 6 cases have been active in the community. The communities that have been involved are quite widespread: Gundawindi, South Brisbane, Townsville, Gold Coast and Wide Bay. This is exactly what we expected. It is not unexpected at all, and it will continue, and these numbers will increase in coming days and weeks. And as we go forward, we'll probably be reporting this in a different way without going down to so much detail. But at this stage, we're still giving you this detail. So as we've heard, we've had 1 case in Gundawindi who was active in the community from the 8th to the 14th of December. Another in South Brisbane who was linked to the Argyle House outbreak in Newcastle, so likely to be an Omicron case, potentially infectious from the 12th to the 13th of December in the community, although their contacts were quite limited. You were aware of a patient that is diagnosed and is currently in Townsville, who was an aircraft that flew to Townsville, but did not spend significant time in the community in Townsville while there. The Townsville case was also in Newcastle, where we are aware there is a very substantial outbreak of Omicron in Newcastle. This particular individual was not at Argyle House, but certainly we are suspicious that he may well have the Omicron variant, and we are treating him as such. There was a patient in the Gold Coast who was infectious in the community on the 14th of December. That patient arrived from Victoria. A patient in South Brisbane who did not spend time in the community but acquired his infection in New South Wales. And another patient in Wide Bay who was infectious in the community from the 13th to the 15th of December. We still have limited details of that patient. We have 1 confirmed Omicron case in a hotel quarantine that arrived from the United Kingdom. She is well, and she has posed no risk to the community. So in terms of the Townsville flight, late last night we made the decision, given that this occurred late in the day, that we would immediately quarantine all patients on that flight until we had an opportunity to discuss first among ourselves, the experts within Queensland Health, but in addition with our interstate colleagues, how best to deal with the passengers on this flight. We took an extremely cautious approach. This is the first domestic flight on which a likely Omicron case has been diagnosed. But moving forward, following these discussions, we believe it will be safe to use our more usual infection control measures, whereby we isolate or we quarantine those people 2 rows in front of and behind the passenger involved, even if it is an Omicron, as we expect. As I've said, this virus is going to continue to spread. It is very clear now that Omicron is very contagious, and most of us now believe that the speed with which we will reach a peak is probably faster than we originally anticipated. I think we're talking more in the weeks than the months, from what we're seeing in New South Wales and in the United Kingdom. It's very much faster and it's much more contagious than what we've seen previously with Delta. So we'll be seeing that in the coming days and weeks, and I think we can reasonably expect that Omicron will spread in Queensland in the coming weeks. It won't be a surprise. We are not going to change our plans as a result of that. The main thing, of course, is to get vaccinated. If you've had your 2 doses of vaccine within the last 5 months, the evidence suggests that you will have good antibody response and you'll be immune, particularly against severe disease. It's early early data. There'll be more information from human data in the coming weeks and months. Most of what we have at this stage is still from the laboratory. If your vaccination was greater than 5 months ago, then it's important that you get a booster. We know when you get a booster, your levels of antibodies climb dramatically. So when you get that third dose, you get a dramatic increase in your antibody levels, which will give you good protection against the Omicron strain, we believe, and that the international community believes, in the coming months, particularly against severe disease. And that's really what we're talking about, preventing severe disease. The fact that we're seeing some patients who are vaccinated getting COVID and getting Omicron, that's not a surprise at all. The patients that I've seen and I've been talking with some of the doctors looking after these patients, the patients we know, I'm aware of have all had mild illness, and particularly those who've been vaccinated. But getting infected if you are vaccinated is not unusual, it's not unexpected. The main thing we're protected against with vaccination is severe disease, and we believe that the vaccines that we are using will be effective.